or good evening, wherever you are in the world. It's actually quite a big topic I've been asked to do in about 15 minutes. So what I'd probably take a couple of hours to go through this normally, but got 15 minutes, so I'll be going through speed and looking at what has the COVID-19 crisis taught us about social protection. So forgive me for if I'm not going into too much depth on any of the issues. I think the first thing is that the crisis has taught us is that we're all vulnerable and we all need access to social protection. It's not just the poor, whoever they are, that need access. We all need access to social protection. That's what we've seen with COVID-19. I think it's important to remember, and this is just to give an example of South Asia, while we often talk about poverty rates at $1.90 or $3.20, you know, and they can give in many countries quite low poverty rates. In reality, most people in low and middle income countries are living on low incomes, as we would understand it in an international context. And often the values that we're given are $3.20 in poverty lines, they're in purchasing power parity terms, so they don't really give a sense of how little it is. So this is just, I don't have time to go into this, just showing the proportions of people across South Asia as an example that are living under certain amounts. I'd just like to highlight India, over 1 billion people. If we look at the data there, how many people are living on less than $5.50 in purchasing power parity terms is almost 90% of the population. Now, $5.50 is very little in purchasing power parity terms. And you can see here, it's only $1.40 in actual dollars in India. Very little, and 90% of the population, that's about 900 million or more, are living on very little. And we see this right across the world. So we need to stop thinking that, you know, there's a small group of the poor. Everybody's living on low incomes. I see Philip Olson's just put out a report where he's trying to make the same point about this, that we're too obsessed with these very low poverty lines. Also, we need to, because that even before COVID-19, we were all vulnerable to crises and shocks. This is just shown from a couple of countries, Vietnam and Indonesia, where ranking people on both countries at the left from the poorest 20% to the richest 20%. You can see the different colors for each percent. And then just 1 year later in Indonesia and 2 years later in Vietnam, we can see the changes in ranking. Very significant change and churning that's going on to show that we, you know, people, we're all the time, we're subject to shocks and crises. And this is why we need social protection. This is why most of us need social protection at the same time. And therefore we have to stop talking about this very simplistic and misleading dichotomy of the poor and non-poor, as if there is a fixed group of the poor and a fixed group of the non-poor, and then we can just give social protection to the poor. That doesn't exist. This idea of the poor is a fictional construct. It's just something in our head. In reality, the vast majority of us need social protection. This has been brought out very much in COVID-19. And just to give an example of the effects of COVID-19 just in one country, this is simulations that we've done with UNICEF in Sri Lanka, looking at the right across the welfare distribution from poorest to richest. You can see what we estimate are the average reductions in income by households. It's around 27% on average, but 30% amongst those on middle incomes, who are still, as we've seen, living on very low incomes. That's an incredible shock to people. That's just the average. Many people, as we've seen from a telephone survey in Sri Lanka, 39% had lost all of their income in Sri Lanka, and 71% had been affected. This is a massive crisis which requires universal solutions, because it's a universal crisis that is affecting everybody and making us and showing that we're all vulnerable. So a key lesson that we need to do from this is to start rethinking the paradigm within which we are designing national social protection systems. Do we want to continue, just as we do in many countries, just giving programs, as we see on the right, to the other, to those we recognize as vulnerable groups, those who are different to us, these poor people at the bottom, the disabled poor, the elderly poor, or the poor of just the poor in general, and we design programs that are not very good quality, very small transfers, we give it to the poor? Or do we recognize that we are all vulnerable and that we all experience a disability? Everybody is being or will, as a child, or will, hopefully many of us will have children, we'll all age and hopefully be able to We will need to access an old age pension. We may all lose our job tomorrow, and many people have lost their jobs in COVID-19. And therefore, we all need to be able to access social protection when affected by a contingency. And the best way to do that is by having universal social protection systems in place. So when we look at designing a universal life cycle social protection system, the type of system that we find in high income countries and in some more developed or middle income countries with more developed systems, what we want to avoid is this kind of poor relief approach, which is dominant actually in many low and middle income countries, where we just give programs to the very, very poor. And as you can see, they're often called social safety nets. They have big holes in them that people can drop through. Or are we going to move from this very old fashioned, which is based on a sort of 19th century model of Europe, which has been exported to many low and middle income countries and replicated in many low and middle income countries? Or do we move to a system whereby we start providing universal social protection so that every child can access a child benefit? At working age, we can access unemployment, sickness benefits, maternity benefits, survivors benefits, all of us. We all are able to access an old age pension, and we can all access disability benefits when we require them across the life cycle. So that's the first lesson that I'll go through. Secondly, I think is very closely linked. I think we've, over the last few years, there's big debates around universal and poverty targeted social protection. Often in many countries, these arguments have been won by those who promote poverty targeting, often because it's cheaper, very low cost. But what we've seen is that these advocates of poverty targeting that have been promoting this have left countries badly exposed under COVID-19 with an inability to provide support to the majority of their population. And this is because, sort of linked to what I was saying before, we've ended up in many low and middle income countries at best with a sort of bifurcated system of social protection, where for those at the very, very bottom, we've given this poor relief or social assistance for the very, very poor. At the top, if you're lucky, and if you're in the formal economy, if you're in the civil service, you can have some contributory schemes or civil service pensions. But right across the middle, we have this missing middle of people who have been exposed and who are unable to access any form of social protection, are not on social protection programs, who are referred to by, as Guy Stan, as the precariat, living very precarious lives in the informal economy on very low income still, even though they're in the middle. And this system has left countries unable to respond effectively because the missing middle have not been on social protection programs. If they had been, it would have been just very simple, just to increase the value of the transfer to give people an immediate response. And even then, for those at the bottom that we're targeting these programs to the very, very poor, we see, and this is a recent study that we've done at Development Pathways, we see right across the world that poverty targeting does not work. As we say, it does not do what it says on the tin. It does not target those in poverty. There's always very, very high errors. These are some very, very well-known social protection programs from across the world, and just showing the level of errors that we find in them. And this is consistent across the world. So on these graphs, we're looking at the poorest at the left to the richest on the right, and for each 1% of the population. And those under the black line are those that are getting the programs, and those to the left of the red line, vertical red line, should be those who should be getting the program. And as we can see, we have very high exclusion errors, from 48% in the Philippines. That's a 48% exclusion. That's almost half of those who should be on the program are excluded. And this is one of the very best in the world, to over 80% in Indonesia on its conditional cash transfer program. Now, these programs are all using the supposedly advanced proxy means targeting. They all have these supposed social registries. So this should be the best targeting we're getting. But even these are incredibly, incredibly inaccurate. So we're not even being able to reach the poorest members of society. What's this meant during COVID-19 is that countries, but if they're using their existing poor relief schemes, these programs for the poor, like conditional cash transfers, are unable to reach the majority of the population. So this is just looking at two countries that have have put in place emergency responses in COVID-19, and our simulations, our expectations of who was reached from that. In Colombia, they've used the existing system and increased the transfers, and you can see very low coverage, even of the very, very poorest. Only 32% are able to access, were able to receive support of the very poorest in Colombia as a result of the weaknesses of their poor relief system. In Pakistan, although the very top, we suggest, or we will probably overestimating perhaps 90% coverage for amongst the poorest 10%, but we still have large exclusion amongst the poorest 3 deciles, 40% or more amongst the third decile, who are still living in absolute and utter poverty. And then for those in middle incomes, who we saw in Sri Lanka, are really, really badly hit, incredibly low coverage amongst both in terms of these responses. So, should we be doing something different, for example, during COVID-19? Are there more effective and better ways of supporting countries? What if countries were to put in place a fiscal response using social protection of 2% of GDP, an absolutely important fiscal response to get their economies going by getting people spending money and providing support to the rest? What about giving support and universal transfers to all children, every person with a disability, and every older person at 2% of GDP? How would that improve the situation? Would we be reaching people better? Well, we can see in Colombia and Pakistan that the blue line is showing what the existing response is doing. The orange line is showing who would be reached in terms of households if they would put in place this package of universal benefits. And we can see in both countries, it's very high coverage and much, much higher coverage for those who receive the life cycle benefits, including amongst those on middle incomes, as well as amongst the very, very poorest. So even under COVID-19, we should be using a universal response. In terms of the impacts that this would have, in terms of the well-being of households, we're comparing here from poorest to richest, the share of household consumption pre-COVID-19 that households are getting from the existing response and what they would get from 2% of GDP given on a life cycle basis. And as you can see here, the existing responses is very, very small transfers. Because they've gone to the poor, the transfer values are very low, and it's having very little impact. But when we're using the life cycle schemes in both countries, we see a much higher proportion of household consumption is being provided, the pre-COVID-19 household consumption. So they're going to make a much bigger difference to the lives of people. So I don't have much time to go into that in more detail, but I think it shows the universal response is important. Then the last thing, and I'm sorry for rushing through, is this frequent claim that we always hear, particularly about universal benefits, that there's a fixed budget or that there's no fiscal space. They're not true. We've seen countries that are politically committed to addressing COVID-19 are finding incredible amounts of money, whereas only a few months ago they were saying there's no fiscal space for investing in good public services. They're now investing incredible amounts. In high-income countries are investing up to 20% of GDP now in a COVID-19 response. This idea there's a fixed budget of limited fiscal space is not true. That was a political choice that countries were making. There's always fiscal space, but we knew that anyway. But often it comes down to the design of programs. What there really isn't fiscal space for are programs for the poor, because the rich don't want to, and them in the middle, because they're excluded, they don't want their taxes spent on the poor, but they're willing to have their taxes, pay taxes if they're going to get programs themselves. So this is just showing, for an example, old age pensions across the world. Those that have higher coverage are more universal in blue, and those in orange, which have much lower coverage. And you can see, of course, as we knew beforehand, the more popular universal programs have much higher budgets. If we were to compare again different types of scheme, the very well-known conditional cash transfers that are promoted by international agencies, not the ILO to say, but many other international agencies on the right, have very low budgets because they're not very popular programs with the majority of the population. Whereas old age pensions or more inclusive universal child benefits have much higher transfer values because these are more popular programs, because they're much more universal. And so we can see there's always fiscal space for universal programs. And this is what COVID-19 has shown us. Because it's a universal crisis, particularly in high-income countries, governments have been putting in place support for those who are in the top 50 or 75% of the population, because there is an absolute demand for doing it, and it's politically necessary and popular. And that's what we need to learn for social protection in general. So just to show, if we look at the population in a country from the poorest to the richest, if we just give programs to the extreme poor, when we're not, the 80% of the population don't want to fund those. That's why these programs are always very low and why there's always no fiscal space. Programs that are reaching those are middle incomes and extreme poor are much more popular. They're going to get a lot more support and a lot more fiscal space behind it. This would be something similar to what South Africa is doing, reaching around 70–80% of the population with social grants, investing around 3.5% of GDP, which is about 7 times higher than the best, 7 or 8 times higher than the best conditional cash transfers, or universal programs where they go to all citizens, where then they're much more popular and everybody's willing to pay the taxes, and we can then find the fiscal space to be able to provide high quality, higher cost programs. And not only are we spending more, it's good for the poor and those living in poverty, because universal programs have higher value transfers than those that are given on poverty targeted programs. This is just comparing on this graph in countries that are much more democratic, have more democratic contexts, and looking at the value of transfer as against the coverage of old age pensions. And we can see the value of the social pension transfer on the y-axis and coverage on the right, so that those more to the right are more universal. We can see a clear trend that the more universal the programs, the higher the transfer value. In fact, amongst those that are higher, that are much more universal compared to those that are much more targeted, the transfer value tends to be double on average. So we can see the real value for people living in poverty of being part of universal programs. So finally, just as I'm ending, what we really need to be looking at COVID-19 is mending the social contract and building social contracts in countries, because what we've seen is that social contracts are weak. That's why we have poor quality programs for the poor, with very low levels, often in many countries, of government revenues, often 10–15% of GDP, which is far too little on which to build a proper, decent society. We need to be pushing the percentage of GDP that is spent on public services and spent by governments up to at least 35% of GDP. So tripling the amount in many countries. Social contract then needs to be strengthened. That's the contract between citizens and government, in which citizens contribute to the nation, often by paying their taxes, and in receipt, they receive high quality public services. Now, when programs are targeted at the poor, they are not high quality. With the very high errors that we see, they undermine trust of citizens, and therefore you undermine the social contract. To build the social contract, we need universal provision. That's what we saw in Europe after the Second World War, is the universal provision which built the social contract, which built the tax revenues of those countries. Because if we don't have high quality public services, if we target our programs to the poor, then we'll find that the social contract disappears and citizens won't want to contribute. And I guess if we come from many countries, low middle income countries, we know people avoid taxes because of the very poor quality of services that we get. So just finally, again, going back to South Asia, to look, there is interest in looking at the sort of 5 countries of the Indian subcontinent and comparing Bangladesh, India, Pakistan, and Sri Lanka with Nepal. The first 4 all have very targeted poor relief, 19th century type of social protection. Nepal, as it's the poorest country, is the only one that's been moving to have more universal social protection in place. It's got a very good universal old age pension. And this graph shows the government revenues as a percentage of GDP across the countries, across Bangladesh, India, Pakistan, and Sri Lanka over the last 20 years. These have not increased because they're targeting poor quality programs to the poor. In Nepal, where we've seen universal transfers, we begin to see a very large increase in government revenues, more than doubling that. Now, we can't say that this is directly because of the universal transfers in Nepal. We can't prove that correlation, but it is interesting to see that the one country in South Asia with universal provision of social security, where government is showing that it's doing something for all citizens, at least at certain points of their lives, and perhaps building trust, is actually managing to persuade people to pay a higher level of tax. And this is the lesson that we need to learn. This is what we've got to do now post-COVID-19. See, this is a crisis like the Second World War was in Europe. COVID-19 is the crisis where things have to change. We have to build the social contract, and that we can only do that on the basis of universal provision to build trust in government. So I'll just stop there, and sorry if I've gone on a little bit longer than I should have.
Thank you very much, Stephen. That's just what I was hoping for. A very good start to this webinar, very thought-provoking. And if you, I know that Stephen didn't have too much time to go into details. He was referring to a particular paper that has been recently published by Development Pathways. We'll have that paper available on the webinars page of the course for all participants, so you'll be able to access and read that paper. And of course, I know that Development Pathways will delve deeper into many of these issues in the weeks to come. So thank you very much. Lots of interesting food for thought there. And I'm now going to pass the floor to Clare O'Brien, who is the Senior Advisor in Social Protection at the UN World Food Programme, WFP. You may remember seeing Clare in her video in phase 1 of the course, where she explained with her colleague Juan Gonzalo about the shock responsive social protection. And that was also based on a paper that we will, that you should have read as part of your phase 1 materials, which is a myth-busting paper, so to speak, on shock responsive social protection. And it's an excellent paper. So if you haven't yet read it, I would definitely suggest you do. Clare is from WFP. She's based in Rome. Prior to joining WFP, she worked for 10 years as a social protection consultant at Oxford Policy Management in the UK. She's worked on a number of issues relating to the design, the implementation, monitoring and evaluation of social protection programs, on national social protection strategies. And she's also very well known for her research on specifically shock responsive social protection. Now, Clare has worked alongside Valentina Barca, who is another of our silent panelists today. But Clare and Valentina have known each other for a long time, and they are both very well known within the shock responsive social protection world. So we're very happy to have Valentina with us as well. She'll possibly come in to answer any questions later. So over to you, Clare. And Giulio, I believe you're going to be sharing your screen. Excellent.
Thank you very much. And good morning, good afternoon, and good evening, everybody. Thank you very much for inviting me to join the webinar. I've been asked to talk to you very briefly on using evidence, how you can use evidence to improve the use of social protection to respond to COVID-19. This flows on very nicely from Stephen's presentation, because you saw a lot of evidence and data in Stephen's discussion, and you can see how persuasive it is when you have the right numbers, or you have numbers that really get to the point of the problem that needs to be addressed, or whether a solution can be effective, or you know, how we're making progress. So this is just going to give you a few ideas for how you can be equally persuasive in your policy discussions in your own countries when you're thinking about planning how to respond to COVID. So next slide, please. So when we're talking about using evidence to support the social protection response to COVID, the first thing to point out is to say, what evidence are we talking about? Clearly, it's too early at the moment for very much data analysis to give us a sense either of the extent and the distribution of needs in relation to COVID or the impact of any social protection interventions. Simply because the crisis has only been happening for a few months, and I'm sure that very much more data will be generated and analysis will be coming out over the months and years ahead. However, people are already collecting information. You may already have information in your own countries. There are also regional and global syntheses of as much data as people can find to try and understand the issues. A lot of the information that is coming out so far, particularly at the level of synthesizing what's happening globally, is focusing on things that people have done as temporary adjustments to respond to COVID. So we see a lot of information about how do I change my program? Do I increase my transfer value? Do I extend to new people? Do I introduce new programs? And this is all really useful information that can help you think what to do. But remember, it's not the whole picture, because in essence, these kind of ad hoc responses that people are developing now, they're great. It's fantastic that people are putting so much effort in to adjusting their social protection systems because COVID has happened. But imagine if you had a really good, adequate social protection system in place all along, then when the next equivalent large-scale crisis comes along, you won't need to be making these urgent and last-minute decisions because the system itself will already be well established. So when you're looking for evidence, there are some places that you can look for to help you think through what to do. Some of that evidence comes from learning lessons from previous shocks. I think we're going to hear later from Chris about the response to Ebola or other pandemics. There'll be plenty of evidence from your countries about what has been going on in relation to climate or weather-related shocks or economic shocks and so on. There's also a lot of regional and global studies, and we've put some at the end of this presentation. I've left a few slides with a few links to some of that literature, so we won't discuss the literature now, but there is plenty. But as I say, you can also focus on the evidence on what does good social protection look like. It's worth investing in that now, and that's partly what Stephen was also talking about. We don't only have to think that if I want to have a good social protection response to COVID, I must have some kind of shock responsive mechanism that's going to be temporary. Maybe the thing to do now, because this is going to be a problem for years to come, is to keep on investing in the good routine social protection. And then specifically in relation to COVID, there is information coming out already. Gradually over the next few weeks and months, there'll be increasing information about trends, about different approaches that countries are taking. There may be rapid assessments going on in your country to understand what's happening. There may also be micro simulations, and what that means is like computer modeling that is predicting what will happen. You can get models that predict the economic impact of COVID or the impact of different policy options. So there are plenty of tools out there. I know WFP has just been developing one in East Africa. I think UNICEF has one for East and Southern Africa as well. And there are various other research institutes that have these kind of models where you can predict and say, okay, if I give this much of support to this group of people for this length of time, what impact is it going to have on my country? So there's plenty of ways that you can obtain evidence. And of course, the important thing is that you can help generate the evidence base now for your own use and also for others. Next slide, please. So here I'm just going to mention 4 stages in your thinking when you're developing, assuming that you are thinking about developing or are in the middle of developing a social protection response to COVID. There may be 4 ways in which you can really use evidence to strengthen the quality of your response. And 2 of these are to do with making sure you really understand what problem you're trying to address. And then 2 of them are about making sure you really are confident that you're coming up with the right solution. The 2 on the problem side is firstly being very clear about where you want to go. So what's your objective? Where are you headed? What are you trying to achieve? And the second one in relation to the problem is, where are you at now? What's the starting point? So if you can use evidence for those 2 things to understand the starting situation and your desired end goal, you can then think about developing your solution, in which obviously to get from your current point to the place that you want to go, there are many different options. So again, you can really use evidence to evaluate which is the best of those options. And once you have put something in place, you can use evidence to monitor the progress of how it's going. So I just have 4 slides in which we will go through each of those one at a time and give you some ideas for the ways that you might think about these things and the way that evidence might be useful. So next slide, please. So firstly, thinking about where you want to go. These stages, by the way, are just very regular parts of any program cycle or policy cycle. So whenever you make a decision about anything, if you are a policy maker in your government, you need to be clear what you're trying to do, where you're at, how you're planning to get there, and how it's going. The stage about where you want to go, clarifying what you're aiming to achieve, is possibly the area that is political or ideological as much as it is evidence-based. So evidence can be relevant in persuading people, but often there is a political imperative or an ideological preconceptions about what ought to be done. But if you're able to bring in data or information or lessons learned from other countries, or maybe ways of reassuring people that their fears about a certain intervention might actually not be founded, if people are worried that that the types of myths that transfers make people lazy or those kinds of things, or we don't have enough money, you may be able to bring in evidence that persuades people to change where they want to go. The types of discussions, you may think it's obvious what you're trying to achieve, but in fact, in the sense that you're trying to respond to COVID, but that covers numerous different objectives. You would need to think, do you want to respond with short-term relief? Are you thinking about the medium to long-term? Are you thinking that you need to make sure that people have enough to live on in terms of their food needs, or also their non-food needs, or their health expenditure? What are you going to do about all of the people who maybe were in a difficult situation in the first place? Do you also want to support them even before COVID? Or are you thinking about only responding to people who've been affected by COVID, because the caseload will be very different? And then, of course, as we mentioned, and as particularly Stephen made clear, you might also be wanting to think about, are you thinking about just an emergency response, or are you hoping to permanently develop social protection? Because then your responses are going to be very different. I'm sure you're familiar with the Universal Social Protection 2030 agenda, which aims to increase the coverage, the comprehensiveness, and the adequacy of social protection. All of those will be really useful both for COVID and for future shocks. And of course, in addition to those, there's all of the aspects of quality that you might want to work on, introducing flexibility into programs, improving timeliness, and so on. A lot of that is covered under the ILO Social Protection Floor Initiative, which I'm sure you're also used to thinking about. Next slide, please. So once you have agreed with your people in the government, your counterparts, where you're trying to get to, everybody needs to be clear what the starting point is. And this is really an area where data can and evidence can be very useful. Both you can understand the needs of people, who has been affected, where are they geographically, which types of individuals or households have been affected, do they have different livelihood groups, how much have they been affected, and so on. As Stephen said, the poor is not a fixed group, and this is definitely true for COVID more than anything else, because it's a once in 100-year event in which the magnitude is far greater than anything before. So it's fairly unlikely that the type of people who would have been considered to be poor or vulnerable before are exactly the same ones that need assisting now. It could be a completely different group and much larger. So understanding those needs is going to be critical. And then also in terms of the starting point, you need to be clear about what the capacities and resources are that exist at the moment. What are their advantages? What works well? What are the shortcomings? Where are those located? Are the resources available in the Social Protection Ministry, or in a disaster management authority, or in a health ministry? Have you got the financial resources, the staff capability, and so on? And you can think not only about the current programs, but also about the whole system, like the overarching system, the legal framework, where the money comes from. All of those are critical areas where you really need to explore the evidence for how things are working now, and then you can decide what's going to work best at the moment. There's just a little clip on the right-hand side of the slide there from a decision matrix that has been developed by SPACE, which is the social protection research in terms of responding to COVID that Valentina Barca is leading on. Where you could imagine there's a whole load of categories of your social protection system, and you can think, how well are the social protection elements working at the moment? How well is the emergency response element working at the moment? And then come to some kind of understanding of what might be possible. Next slide. So then, having understood what the needs are and what the current state of your programs and your systems are, you can then assess the policy options. This is really, again, a point where it's crucial to look at the evidence for what really happens in your country. There's a lot of ideology that goes on in this space in terms of social protection and linking emergencies with social protection, where you see people say things like, oh, it's faster and more efficient to deliver emergency response through social protection. But actually, firstly, that's not necessarily true. It might be slower and less efficient. And secondly, even if it is true that it's faster, that doesn't necessarily mean that that's the reason why you should choose it, because maybe it will deliver assistance fast, but to the wrong people, or maybe there'll be lots of exclusion errors. So there's a couple of resources there that help you think through the fact that every option that you may decide will have trade-offs and risks. Something will be great for coverage, but a bit slow. Something else will be fast, but maybe won't be sustainable in the long run, or it will be expensive. Some options will really help with long-term sustainability and embedding new parts of the system. And you need to decide which of those things you're willing to accept as a trade-off. So again, using all of that evidence that we talked about earlier, how things have worked in different countries, how you think things might work in your country, you can come to a really solid decision about what you want to do for the COVID response. And the final one, the next slide, please, is to think about the fact that you can continue using evidence once you have made your decision. You can keep generating and using evidence as you go along to monitor your response. So you should plan how you're going to collect and use the evidence of what's happening on the ground, which is going to be quite difficult in the COVID situation, but there's plenty of information available about, for example, remote monitoring. I know that World Food Programme does quite a lot of that, and I'm sure many other agencies do as well. You can do ongoing monitoring to kind of adjust your program in real time to see how it's going. And also you can plan for evaluations and lessons learned that will guide future responses. And it's worth thinking about those now, because some of them will want baselines in order to be able to look at impacts in the years to come. So really worth thinking about that right from the beginning as you plan your response. So that's it from me. I think those are the few ways that you can think about using evidence in your social protection response to COVID. The remaining few slides in the presentation, which I hope you will see, maybe you could just run through them, please, just to flip through, show people. There's some further resources, and again, next slide, and one more there. So we've got a few examples of some publications that you might be interested to have a look at, and there's a mention of a couple of the online communities on socialprotection.org where you can join conversations and obtain documents and get extracts from webinars and so on this topic. So thanks. That's it from me, and back to Costanza.
Thank you very much, Claire. That was a very clear and comprehensive and logical presentation. So I think it'll be very, very helpful for participants who are thinking about their assignment. As I said earlier, a theory of change. I think you took them through some very good steps for thinking that through logically. Particularly, what I liked was when thinking about policy options, the trade-offs and risks, which is very important, and of course the use of the evidence at every step, and how they can best use the evidence. So thank you very, very much for that, Claire. So I can see that people are asking questions as we go along, and questions are being answered. So thank you very much to our panelists for doing that, multitasking as we're hearing all the presentations. And thank you to our participants for asking questions as well. Some of the questions were about whether you will be able to access the PowerPoint presentations. Yes, as always, they will be made available on the webinar page of the course platform. So if you go back on it after the webinar, maybe just give us a few minutes to upload them, but you should be able to access all the PowerPoint presentations and any additional resources that may have been mentioned during the webinar, or I will ask our panelists to maybe send us further resources that we can also upload as additional readings or even videos if they have any that participants can access after the webinar. Okay, so we'll move on to Chris de Neubourg now, who is the director of the Social Protection Research, Social Policy Research Institute in Belgium. Again, probably a familiar face, given that that Chris recorded one of the videos that you will have watched in phase one. He was also a key resource person on cash transfers in the webinar that we had with participants. We all broke up into breakout rooms, so hopefully a familiar face on our course. So Professor de Neubourg has decades of experience in economics, social policy, social protection, you name it, he has it. He worked for UNICEF as Chief of Social and Economic Policy Research. Since then, he has branched out and developed his career phenomenally in academia. He is a professor of economics at Maastricht University. He's also a guest professor and lecturer at a number of other prestigious universities from around the world, from Japan to Mauritius to Paris and the USA. He has long-standing experience with projects and research-oriented consultancies for the World Bank, UNDP, UNICEF, OECD, and a lot of the bilateral donor agencies in Africa, Asia, Central Asia, and Central and Eastern Europe. And he's also published many articles and books on labor economics, poverty analysis, and social protection. So over to you, Chris. Today he'll be talking to us about the lessons that we can learn from past crises, particularly health-focused crises and shocks and pandemics. So over to you, Chris. Are you able to turn your camera on as well?
Sure.
Yes, there we go. Hello, Chris. Nice to see you.
Hello. Thank you, Costanza. Welcome to everybody. Nice to see familiar faces as well. and happy to contribute to this webinar. I will not use a PowerPoint presentation, against my habit, I must say, but I think that I thought that I would be able to talk more naturally if I just make up the story about, okay, if we look back at crisis, including the current one, what actually are the big lessons to be learned? And I think some of the lessons are already put forward by Stephen and by Clare, but some of these things can be packed in a different way in order to reinforce actually the messages that they have brought forward. But I think I choose to take a little bit more very pragmatic view on what we learned and what would be important for to come. And I have 7 points, 7 lessons that I take away from crises in general and this one in particular. And some of these lessons are straightforward. And of course, and if I will tell you them, I say, of course, there are lessons. But they nevertheless, and the crises are with us for many, many years, decades, centuries, we constantly face the same type of difficulty. And the first thing that happens is that every crisis needs immediate help. People are not, you cannot sit down and think about, oh, what's our social protection system can do now to face the crisis or the problem. Crisis, the nature of crisis means that you don't have a lot of time to think, and that you will have to come up with something that works, and that works immediate, or almost immediate. And that's not easy, and definitely not easy when we think about social protection. But it's an important thing. So we'll have to think about what can be done on social protection that would work and would give immediate relief for the people that need the relief. That's for crisis in general. For this particular crisis, we have an additional problem. We need immediate help for everybody. Okay, not everybody, but almost everybody. So the number of people in the population that we're looking at, definitely in the populations in Africa and Asia, and most of the populations in Latin America as well, is that we need help for everybody. And if we leave out too many people, the help will be not effective and efficient. So that's the first lesson that I take. The second lesson, which is a lesson that we used to forget, except if we think, when we start thinking of courses of social protection, when we have discussions and debates on social protection and what social protection is like, then we have this debate on what's the role of the government. Cannot social protection be organized by the people themselves? Cannot social informal transfers of any kind, either in kind or in cash, isn't that social protection? So why would government step in? But crises make very clear that the answer is no. Social protection, informal social protection, is no protection at all. In a crisis like COVID, but also in crisis in that encompass entire regions or nations, there is no other. Everybody is affected, and informal social protection instruments break down. So governments and government or public authority backed social protection that gives you rights is crucial to respond to crisis, as they are crucial to respond to all life cycle risks. As Stephen in the beginning explained to you, there are risks along the life cycle for nearly everybody, and social protection is an organized response that gives you a right to assistance when you need it, when you're confronted with the contingency of a risk. That was lesson 2. So governments are crucial, and social and informal social protection, charity will not do the job. Third lesson is that the basics are important, and the basics are, and then I would like to refer to our experience in Europe under COVID-19. And when people asked me, and I was asked for the Belgian television to comment on it, I said, and all the commentators in the television are always very pessimistic, and it's hard for the society. But my conclusion was, wow, it works. Most of our social protection system works. But I'm happy to live in one of the 11 countries around the world that have, according to ILO statistics, a nearly 100% coverage for all the risks that you can think of. If you open the World Social Protection Report, you will see the ILO statistics, and then you could see at the coverage rate, the legal coverage rate of each of the elements of the social protection building or architecture. And then you will see there are 11 countries, all of them in Western Europe, that provide 100% legal protection to all the citizens for all the risks. If you have a system like that, then when a crisis hits, this 100% of the people will be covered. And so your crisis response can be a lot more simple, and because it's building on what's happening anyway. In economic terms, we call that automatic stabilizers. What actually this disability, unemployment benefit, health benefits, illness provisions for short-term illness, all these things do is stabilize the income of people when things happen. It stabilizes not at a replacement rate for 100%, in most cases, in some cases it does, but it stabilizes so that the shocks to the people's income and the people's wealth are damped. But it also stabilizes our economy because it makes sure that the demand for goods and services keeps them at a certain level such that the economy can keep on functioning. Now, under this crisis, the particular element there is that the economy didn't keep on functioning because we were in a lockdown. So that element was less important. The demand part was less important for the economy because a lot of the demand was not effective demand in the sense that goods and services could be purchased. But if actually in other crises, like in financial crisis, it's an important thing. And I think this reinforces the lessons or the messages that were put forward by Stephen, saying that if you have a social protection system, if you think about a social protection system that is universalist in approach, doesn't mean that everybody gets a social benefit all the time. Of course not. But it's universally in approach in the sense that it covers the risks of people throughout the life cycle. It's easier to build on that one and on that one when a crisis hit. The only thing you have to do, since you don't have to worry about expanding the number of beneficiaries, because the number of beneficiaries is already, or potential beneficiaries is already 100%, you don't have to think about that. You only have to think about, is the level of replacement that I offer under these crisis circumstances, is that adequate? Which is a much easier exercise than thinking about the fourth lesson that I put forward. And the fourth lesson is, how do I identify the people that I should target, that I should focus on when thinking about social protection under crises? In the basics of a universalist system, you don't have to think about that because you already thought about that. You already thought about the risks and you already made sure that if not 100%, at least a big part of your population is covered. And you only have to think about is the assistance that I provide, is that as a government, is that adequate given the situation that people are in? That's not the situation, and I'll tell you, it's only 11 countries, and some of these countries are pretty small, like my own country. So it's a very tiny part of the population that is covered by these systems. The rest of the world is not covered by these systems and faces the problem under a crisis, the crucial problem of identifying who should get help. And then there are 4 problems. If you don't have the entire problem there, you will have to think about the people that are already under your current social protection system, which is not universalist, that are already recognized as being poor, however defined. And then that's the first group of people that you can look at. That's the easy group, because that's a group that you already identified. Maybe the wrong group, as Stephen explained to you, you may have made a couple of inclusion errors, which makes that this list of people is also containing people who don't need your help, or at least not need your help that much. But at least you have there the people that you recognize as needing help. The second group of people that you have to think about is that because of the way you identified the first group, you missed people, you excluded people that should have been recognized as part of that group, but for some reason, administrative reason, or reasons in the effectiveness of your instrument, of your identification or targeting instrument, are left out and should not be left out. So you will need to have an idea of who's being excluded and where are these people to find. And then there are two new groups under every crisis. The first group are the newly poor, people that are not poor at all and not even close to a poverty line, but are, say, the middle class or the upper middle class in a country that become poor because of the crisis. These people will need your help as well. And this is the number, these are the group of people that you will have to address. And then as a part of that group, there are the group, what we call, when we think about responsive social protection systems, as the suddenly poor. The suddenly poor are people that are never thought in their life they could be poor, but become suddenly poor because of the crisis. Because, for example, that doesn't happen in this crisis, in COVID-19, but it happens with earthquakes or volcano eruptions or floodings. People lose everything they have. They never in their life even give it a thought that one day they would be poor, but they become poor. And these people need assistance as well. So identifying all these groups, if you have to do that during a crisis, is very, very difficult. What a lot of countries that we work in have are registries. And registries are pretty important, but not in the way we usually think. We think about social registries, but actually social registries only cover the first group. They don't tell you anything about the three other groups. They don't tell you anything about the group that you, by making the registry, have excluded. They don't tell you anything about the new poor or the suddenly poor. And so social registries are there, but they actually magnify the problem of their exclusion and inclusion errors. So crisis really makes these inclusion and exclusion errors bigger rather than smaller. And so we will have to think about preparing for the next crisis, because that's also what I think we should do, is that rather than trying to identify the poor and assume that they will stay poor for the rest of their life, what a lot of these social registries do, or at least for the next 3 or 4 or 5 years until there is a new funding from whatever source to redo the exercise with the social registry. Rather than doing that, is investing in civic registries. Registration of children at birth is not only important for these children, but it's important for the population. If you don't know how many people are living in your community, in your country, if you don't know why where they are living, if you don't know what the demographic composition is, it's very difficult to think about the help that people will need. So I think this crisis, like every crisis, should give a serious incentive to invest in civic registries. Civic registries with crucial information that will help you to identify the people that you would like to help in the future during the next crisis as well. Then there is an important, the fifth lesson that I take from this crisis and the previous crisis is that cash alone will not do the job. Cash is very important. And I think cash transfer can be quick if there is a good basis in the social protection system. It can be quickly disbursed. It can be efficiently disbursed, but it will often not do the trick. If you look at this particular crisis, made this very, very, very clear, but also the previous crisis in Ebola. In Ebola, when we did the research in Guinea and Sierra Leone during the previous Ebola crisis, the crisis was not, or the needs were not so much with having not cash. Also because the economy didn't collapse. The economy shrinked in the communities that were heavily influenced by the Ebola crisis, but was not reduced to nothing. Although interactions were difficult and some people lost their income, but there were much more pressing problems. And the two pressing problems, most pressing problems, were with health and with children, and health. But with health is that because a crisis like COVID, like Ebola, but also HIV/AIDS absorbs so many resources in terms of human capital, in terms of human resources, in terms of money, that we forget about all the rest. And that even happens in our countries where the health system is working pretty well, but still everything which was not COVID was kept out of the hospitals. And that led to people dying. So in less developed health, public health systems, the damage is much bigger. The estimates, and you can find them in the literature regularly, also on the COVID-19, is the estimates of the number of people that will die or that already have died because they didn't have access to health when they need it at a health crisis, a private health crisis. For children, the thing is even worse because not only they don't have access when they get ill and so will die from an illness that they otherwise wouldn't die of, but also they are not, the entire prevention part of the health system collapses. UNICEF estimated the number of children that will not get vaccinated for measles even within 12 months, and it's millions of children. Many of these children will die. Measles is still a very deadly disease, and if you lack your services in vaccinating the children at the right time, then some of these children, a particular significant number of these children, will die. So you create another crisis, a health crisis, by not addressing that health problem. The second group of people that is heavily affected by these kind of things are pregnant women. If you don't have access to antenatal care, natal care or postnatal care, then we know from research that a lot of these either mothers or children or both will not fare well, and in some cases will die as well. So this is a problem that the cash part of the social protection system will not solve. But we will have to think about what the public health part of the system or the health insurance part of the social protection system can solve. And finally, of course, there is the schools, and that creates much more serious problems. And that also came out of our experience with Ebola and HIV/AIDS crisis in the past in Africa. Is what we see there. Schools are closed. Schools are closed under COVID-19. Children are not going to school. In the beginning, most children think it's fun, and you have a long holiday. After a couple of weeks, it becomes very boring, and you miss your friends. And after a couple of months, all other things are start to, not months, even in weeks, 1 month, 2 months, and a lot of secondary effects happen. And these happens especially when we think in child protection terms. Children are no longer protected if they are not at school. They're no longer protected because often, in many countries, they don't have access to food. Because school meals for some children and for a serious number of children in many countries is the only and the best food they get in a week. So if you don't go to school, you don't have meals. But if you don't go to school, you're home or in your small community or in your large community, all 24 hours a day, which makes the chances for violence and abuse, including sexual abuse, a lot bigger than they used to be when children are at school. And we know, again, from estimates and simulations, but also from rapid appraisal studies, that the number of women and children confronted with this violence and sexual violence and sexual abuse is incredibly during a pandemic like COVID-19. And it was the same problem with Ebola. And it was the same problem with HIV/AIDS, where often orphans were abused much more often than they were without the crisis there. So that again, cash is a problem that cash cannot solve. So we will have to make arrangements in our social protection system that makes that at least reduces the problem to proportions that we can handle. And often it's time, and of course the crisis is not the time to think about these solutions. But I give you my experience, which was an eye-opening experience, especially for the people we worked with in Cabo Verde. Because in Cabo Verde, the bishoprics are volcano eruptions. Now, Cabo Verde islands are very small. So if there's one of the volcanoes and one of the islands erupting, everybody has to leave the island. These are not big communities, but at least a couple of thousand people have to leave an island immediately. There was an emergency system, there is an emergency system in place that regulates that good and well. And we have boats and we can people of the islands. The only thing is that then these people arrive at other islands. So I asked them, what do you do with all these people arriving in another island? I said, oh, we put them in schools. So my next question was, what do you do with the children? Because these people cannot go home for a couple of weeks. So I said, schools are closed. So children are not going to school. They never told about that. And it can be, so if you think about preventing crisis, you probably also have to think about this kind of things. What do you do with schools and children at school and not being at school? Finally, about schools, we have seen during the Ebola crisis that a lot of children that were not going to school for half a year never returned to school, which of course is tragic for the children, but it's also an enormous loss in productive capacity for the country. So also from an economic point of view, not only from a social point of view, from an economic point of view, these are the important things. Wrapping up, I think that the most important things that I learned are that we have to think about a social protection system before a crisis hit. We have to think about a social protection system that covers everybody who can be the victim of a crisis. Well, that's nearly everybody in a society. So probably you have to think about social protection system that may work at that part. Thirdly, we have to think about, when we think about how we react to the crisis, it's not only a matter of cash. It's also a matter of cash plus, of providing services that are still important and may be life-threatening or life-saving for the people that are involved. The final question that I'm not going to address, but I will put on the table, and we can discuss probably either in the chat or or later on during the discussion, is nobody talks about how we're going to pay for all this. Countries are poor, don't have resources. Stephen already gave you the small amounts that we needed for giving universal cash transfers to children, to elderly, and a basic coverage for the people in the middle years of their life as a disability benefit. That's not so much. You can do a lot for 1 or 2% of GDP. Stephen already said that what we spent, and I refer to we as a general in the European countries, it's much more even in the US, we spend 10, 20, 30% of our GDP currently on making sure that our social protection system, in the broadest sense of the word, is made to cope with the crisis. And of course, we will have to pay that back. But it also, because it has to be loan driven. So I think when we prepare for the next crisis, that one of the things we should do is seriously talk to the World Bank, to the fund, the IMF, how we make this 1 or 2% of GDP provisions that will be made available when the next crisis hit, or under what conditions loans can be given to countries under soft conditions so that they will be able to pay it back. But I think it's a very important thing. And it's not an excuse not to think about effective social protection that works for everybody. Thank you.
Thank you very, very much, Chris. I think you've taken us through a lecture in a nutshell. So thank you for doing that, and for all the really important lessons that have sparked quite a conversation already on our chat. And you've left us with an open question that we'll definitely go back to. I know it is a popular question that people are also asking, given that they're confronted with the reality of needing to expand their social protection programs, meet the surge in needs and demand, and at the same time they're under a lot of fiscal limitations from their own governments. Although, as Stephen was telling us, of course, we have all learned that fiscal space is indeed a relative concept, and the political will is indeed much more elastic than we potentially thought before. So again, food for thought, we'll go back to it. I would like to now move on to Helmut Schwarzer, my colleague. So Helmut is the Senior Social Protection Specialist at the ILO Country Office for Mexico and Cuba. He is based in Mexico City. Hello, Helmut. It's very early for him, maybe less so now. He is another economist by training, and he was Undersecretary for Social Security in Brazil, as well as also Undersecretary for Citizenship Income at the Ministry for Social Development, also in Brazil. And he was responsible for the management of the Bolsa Familia program that many of you, I'm sure, will be very familiar with. He is the Senior Specialist for Social Security. He was the Senior Specialist for Social Security in Latin America and the Caribbean at the ILO headquarters in Geneva before being based in Mexico. So over to you, Helmut.
Many thanks, Costanza. I would like to thank you very much, Costanza and Charles, to the Center in Turin for the invitation to be part of this course, of this webinar, and the opportunity to contribute to this effort of transferring our training to digital mode. Then I would also like to greet my colleague panelists and all the participants. Well, after those lectures, which were very enlightening and very rich, I want to present something, or I was asked to present something, maybe rather on the ground in Latin America. We have just released, as a team in Latin America, a new paper on the development of the labor markets in Latin America under COVID-19. It is available in Spanish for the time being, and it is about the impacts on labor market and incomes in Latin America and Caribbean. It's a technical note, actually, to, let's say, to steer the discussion which was made last week in the global in the forum, which the ILO has promoted, regional forum. And today, tomorrow, and the day after tomorrow, our DG will be leading a global forum on COVID-19 and the consequences, the way forward, how to move towards the future of work under the present circumstances. So the first part of my presentation will be about the contents of this paper, and then I have a final slide on how Latin America has reacted to social protection, and maybe some thoughts on lessons or on possible developments over the next years. So the first slide, the first graph, sorry, it is in Spanish. I copied it from the paper. It is about the growth rate, GDP growth rate. For Latin America, certainly the same in other regions of the world as well. This is an unprecedented recession, which we are seeing. The World Bank estimates that on average, the recession will be of 7.2%, IMF 9.4%. There is no comparison with previous recessions over the last 70 years. If you see the deepest recession before was in the early 1980s, when Latin America had the debt crisis, 2.5% in 1983, and then in 2008, 2009, the world financial crisis, 1.8. It is important to see that actually in the previous years to the current situation, and since 2014, maybe Latin America had already presented very low growth rates, slowing down the economic growth, and as a consequence, labor markets had suffered, labor markets and also the financing of social protection systems because of the downturn of the global commodity cycle. You may remember that China slowed down growth, and since Latin America is very specialized on commodities, that had an impact on the economies of Latin America. The next slide is a synthesis of the characteristics of this crisis. It has already been said that it is a crisis with high-speed impact all over the world, a systemic crisis. It affects differently from other crises, from previous crises. It affects all countries of the region at the same time. Maybe it's important to understand, or maybe to recall, that the 2008-2009 financial crisis had affected more directly Central America and the Caribbean, Mexico, and these two regions, because they are more strongly linked to the United States, more dependent on the United States, whereas South American countries had a more diversified pattern of international relations, so they were not that much affected. They were affected, but not that much affected as Central and America, Mexico, and the Caribbean by the 2008-2009 crisis, whereas now all countries are affected at the same time by a supply shock followed by the contraction of aggregate demand. As already seen before, we have let's say problems or limitations regarding the response that Latin American and Caribbean countries are able to provide. Firstly, even if we had the so-called, let's say, golden decade from 2004 to 2005 to 2014-15 in terms of improvement of the formality rates in Latin America, informality still was very high, about 46%, 47% of employed population. So informality is already a burden because it means limitations regarding access to social protection system. It means a whole array of weaknesses in terms of, let's say, the effectiveness of labor and social rights in Latin America. So this social tissue is very fragile. Then, of course, well, the issue of fiscal space, which has already been discussed here previously. However, let's say the downturn of public revenue over the last years and austerity policies had affected, let's say, the integrity and the effectiveness of social protection systems. And, well, as a consequence, health and social protection systems were caught not in their best moment in Latin America. Then another issue which is relevant to mention is that let's say the adjustment mechanism, which means increase the resort to informal employment in case formal economy is under shock, it doesn't exist in the current situation. So social distancing, confinement, lockdown means that there is no space for self-employment as a means of let's say, counteracting, of coping personally with this crisis. Latin America has a characteristic that between 20 to 40% of employment is self-employment. So 20%, Costa Rica, Colombia, Venezuela are about 40%, and in between all other countries of Latin America and the Caribbean. So this is another, let's say, issue to take into account. And then COVID is not only a disruptor, it is also an accelerator of trends. Unfortunately, not only desirable trends, but also the trend towards more inequality, increasing gaps, increasing differences, because it hits stronger those sectors where most vulnerable people are occupied. So I'm not going to show this the tables here in the technical note. There are some tables that analyze which are the sectors that are more vulnerable and the profile of the employment in those sectors. So it will probably have as a result an increase of inequality in Latin America. So it's uncertain how markets will react. Our crystal ball, we try to polish it, but we do not know exactly which will be the shape of the labor market over the next years, how the adjustments and how the dynamics will be. It is a very, very specific crisis in the current situation. What we know is, on the next slide, unemployment rate has never been so high as it will be in 2020. According to the GDP projection you use, be it World Bank, be it IMF, it could be between 12 and 13%, from 8% in 2019. A few weeks ago, I read again our annual labor market report, for which the ILO, the regional office, produces at the end of each year. And we were saying in late 2019, early 2020, before COVID crisis arrived, we were saying that Latin American unemployment rate would be bad in 2020. It would increase from 8.1 to 8.4. Now we have to review our forecasts to 12.3 to 13%. So you see how COVID really deepened the trend in terms of unemployment rate. Next slide shows a few information, let's say, a little bit more detail. I'm not going to, let's say, to astonish you with a number of, with a flood of figures. I think it's only, let's say, relevant to have this in mind, that approximately 15 million workers will probably join the unemployed labor force, totaling 41 million unemployed in Latin America. This is what we can read from the first labor force surveys, which are available after the COVID crisis impacted. For example, in the case of Mexico, this is and of Brazil, these are only estimates. It's not something which we have published. It's only, let's say, first internal calculations that unemployment rates could increase from 50 to 100%. So could increase from times half to times to double. In case of well, the occupation rate, so the percentage of population which is occupied, the percentage of active population which is occupied, it falls even if there are policies which aim at keeping people in employment. In a number of countries, for example, in Mexico, it was forbidden to dismiss workers. In other countries, like Brazil, Uruguay, Chile, unemployment benefits were combined with rules to keep people on the job. And even so, the rate of employment is falling in Latin America. Then there is a very strong in transit from informality and self-employment to inactivity, to non-activity. People move towards the non-active population because of the confinement, because of the lockdown policies which were adopted. In the case of Mexico, the Statistics Institute has published telephone surveys in the months of April and May, and something between 10 to 11 million people left the statistically defined active population and went to the inactive population. So, and this also has a strange, let's say, statistical effect in the first moment, that informality rate falls, because people are not defined as being active, but this is only a temporary effect. After the, let's say, the truth of the labor market is reestablished, we will probably have a higher rate of informality in the Latin American countries. And the final bullet point here is that the confinement policies have strongly affected the income of informal and self-employed workers. Well, we have already seen the telephone survey in South Asian countries. In Latin America, it's the same trend, especially in the non-essential activities. Hence, the need for benefits be them emergency benefits, be them already existing programs that are universalized or that are extended to those who will lose their income or who have lost their income, to allow people to stay at home and comply with the confinement policies. Next slide shows a graph on the informality rates. As I told you, 2014 was, let's say, the last year of this golden cycle reduction of informality rates year by year between 2005 and 2014. There was a steady fall of informality rates in Latin America. However, the slowing down of economic growth over the last years had already accelerated informality, and we fear that after let's say the first wave of the impact of COVID on the Latin American labor market is gone or is behind us, then we will have probably a labor market with higher informality rates than previously. So we may lose a big part of the effort that has been done in previous years to formalize employment. Yes, I have already mentioned to you that a big number of people have left in the short run informality, went to non-activity, but as soon as the confinement policies are loosened, we will return to the previous situation and maybe even worse. I still have 2 slides. The next one refers to to another publication. This is rather a global publication on the ILO monitor on the number of hours lost due to the COVID policies, the policies to counteract COVID, and due to the reaction of the different economic sectors. On the 30th of June, our colleagues from headquarters have published the 5th edition of the ILO monitor, and Latin America is a region with the highest loss of working hours among all regions. And it is equivalent to some 55 million jobs. In terms of working hours lost, if there is a recovery, this equivalent to 55 million jobs could hopefully be reduced, but it will be over time. So it will not be an immediate recovery. And that also means that an important number of people will be without their incomes. In the case of Mexico and in the case of Peru, our headquarter colleagues were capable of using the information available, the surveys available, and calculated that the most significant adjustment process was people who have lost their job, mostly in the informal sector, and went to inactivity. In the case of Mexico, 49% of people who changed their status in the labor market followed that path. In Peru, 88%. So this is quite a heavy, let's say, phenomenon, very different from what happened in other regions in North America or in Europe as well. And my final slide is about the reactions, social protection reactions to COVID in the Americas. Also on the 30th of June, our colleagues from the Social Protection Department, they update that website on social protection responses from times to times. You may consult, you may you may check different regions of the world, different countries. It is very interactive. And these here are some graphs, this is some information about Latin America, and not only Latin America, but Americas as a whole, Caribbean, North America, and Latin America. So 44 countries, 332 measures have been registered by our colleagues in Geneva, and the most relevant ones in that column in the middle are introducing new benefits. Part of the benefits for poor or vulnerable population, part of the benefits extending coverage to workers and our dependents. Maybe also interesting to see the graph on the right. 55% of the measures are new programs or benefits, and 25.9% are changes in existing programs. So I think that this is a good, let's say, summary. Now, which are some lessons? My last line here at the bottom of the slide is emergency benefits or social protection floor development. Well, we have had over the last 10-15 years important developments in Latin America in terms of social protection floor, especially cash transfers for children and old age pensions. Non-contributory benefits were developed in almost all countries of Latin America. I think that this is an important development. Important lessons have been accumulated, and the existence of these programs has helped governments to react more quickly to the COVID crisis. I think that as some lessons from Latin American countries, we can draw that universalization of health coverage is important. Maybe the consensus, there can be a consensus in some countries, even if there are, let's say, conservative views currently predominant in many countries in Latin America. But I think that there is a possibility of building a consensus that universalizing health coverage is key for this new social contract. Another important lesson is that improving the coordination of these fragmented pieces of, especially of the health system, countries which have a number of different institutes covering different parts of the population, improving the coordination, unifying criteria, and this being an approach for universalizing coverage, for covering the unprotected middle, that this is also something that is feasible. A third consensus that may be reached in Latin America, some countries are already moving towards it, is the extension of unemployment benefits. Paraguay, for example, is moving forward. There are only 7 countries in Latin America and 3 countries in the Caribbean with an unemployment benefit scheme. Mexico has no national unemployment benefit. Mexico has only an unemployment benefit in the city of Mexico, which has a level of a state. So the city of Mexico is one of the 32 states of Mexico, even being a big one in terms of population. But a country like Mexico needs actually an unemployment insurance and unemployment benefits, not only insurance for the formal workers, but also unemployment benefits for the informal workers. And this trend or this branch has big gaps, and it could be also a third consensus point in terms of extending coverage in Latin America over the following years. And well, it remains to be seen. The discussion about fiscal space, austerity policies, how to deal with accumulated debt to react to this crisis, and also the fact that losses in terms of GDP mean that the debt to GDP ratio increases. So all that, let's say, the discussion of the public finance will emerge soon, if not already emerging. So it will be, let's say, a big challenge to defend the extension of social protection in Latin America over the next years. So I finish here. Costanza, many thanks, and sorry for having taken so much time.
Thank you very much, Helmut. That again was a very comprehensive presentation, focused on one region, but I think it brought to light many commonalities with other regions. I think what you said about COVID being a trend accelerator, that's very true, and I think that applies across the board, and it's something to think about. And then I was very interested in what you were saying about the shift that COVID has accelerated, or in fact triggered, from informality to inactivity, which you then went back at the end saying, well, you know, however, in our region, you know, we do have a long-standing tradition of universal social protection, you know, strong systems. I wonder if there will be evidence to show that the same pattern is happening, the trend is emerging in other parts of the world where perhaps social protection systems are not as developed or strong or responsive, perhaps, and how that will have very long-term implications with regard to moving onto the road to recovery. So something perhaps for us to think about. I might ask that to our Director of Social Protection for the ILO on Thursday when we speak to her and other UN thought leaders on social protection, because it's the sort of thing that we need to think going forward. So we only have 10 minutes. I thought we were going to be much quicker, but there's been frenzied activity on the question and answer chat, which we will make available. It's turned into a little technical note in itself, which is great. And I would like to thank all our panelists for taking the time to answer all these questions, providing additional information, additional data on most of the questions that were asked. So given that we only have 10 minutes left and that we've managed to have a healthy question and answer session in writing, at least as the presentations were going on, I just wanted to go back to the panelists, and I would really like to include Valentina Barca in this, who's been a silent but very active partner in this webinar. Her fingers must be burning because she's been answering almost every question that was posed. So thank you very much, Valentina. I would like to go back and perhaps start with Valentina to see if you know, the one thing that perhaps they've picked up, or maybe they weren't able to answer, or the one thing that maybe caught their attention and that they would like to leave the participants with as a memory of this webinar. There's been many issues that have caught my attention. Other than the ones that perhaps were raised in other webinars, including the financing of social protection, you know, very important issues. But I think the tension between central governments and local governments, all the discussion around social registries, which I know are a very hot topic, particularly at this time. And then what caught my attention was the importance of community responses, particularly as Chris was mentioning the lessons from Ebola. So I know that some participants have written on that, and I know that Valentina and Clare have responded to some of those questions. the role of communities, speaking to communities, community responses, community acceptance, both in terms of identifying needs, but also in terms of making responses sustainable, particularly as we're looking to a protracted crisis. And then I think there are questions about, similarly, the role of the private sector. And of course, the missing middle, and some very good examples that our panelists wrote about in the chat that we will share with you. So just 1 minute each to summarize the one thing that you want people to remember from this session. And I will start with Valentina.
You're being nasty here.
Sorry, I didn't mean to.
Yes, yes, thank you for allowing me to speak for 1 minute. To be honest, I feel like I was responding to most of the things in writing, so hopefully those across some of the resources that I shared will be useful for this. In 1 minute, what I'd probably say is, just to repeat some of Clare's key messages, is start from understanding the needs, and I think a lot of the evidence that we're seeing to date is showing that the people who are affected are not our usual suspects. Those that in most countries, low middle income countries, are those who are usually included in social protection and especially social systems, and where you've got 80+% of people in the normal economy, as a few of you have mentioned in several countries. That's really where the gap is. So let's zone into that gap. Let's look also at kind of urban areas and peri-urban areas where we see most of the people affected are, and also understand the different livelihood groups and how they've been affected differently. We've seen that own account holders and those who are working for themselves are actually those amongst those who have been most affected. So again, it's about kind of getting rid of our usual mindset and taking COVID as an opportunity to think broader, think wider, and also ideally sort of act now, but think medium term. So as every single panelist has been repeating this, it's fine to be doing some of these quick, innovative, interesting types of responses, but if there's just a one-off, then what foundations are they really setting for the future, and what is the vision for that future? And just really clear on the social registry discussion, I'd be keen to move away from the social registry towards more information system look like, and what are the pieces of that? Because ultimately it's about, we are moving towards a more digital delivery model, and we've seen some countries, the ones who respond quite effectively are the ones who have leveraged technology in important ways. So how do we build an information system in a way that follows that vision of what a more universal social protection system could look like, and that will encompass links to civil registration, disability registries, other government administrative databases, and how those work together to actually include and how we start distances is fundamental. It's not just having a social registry, it's about how that or any other registry or information system, or how registration in your country works. Do you have an on-demand system for people to be able to apply when in need and enter the system when in need? And the core questions that we'll have to be asking going forward. The super last comment is on the local actors element, and I think there's a lot of untapped potential to leveraging local actors better within social protection, almost incorporating some of the social insurance kind of tripartite agreement type of concept into social systems, and for example, including informal work organizations in that process and other local women's organizations into some of these processes more effectively going forwards. Sorry if that was all over the place. You cornered me and I wasn't expecting that. Thank you.
Sorry to put you on the spot, Valentina. I thought you did very well. Covered a lot of ground. I'm sorry the sound perhaps wasn't excellent, but I hope people managed to make up what to understand what Valentina was talking about. So I think we'll go with Clare after that. Clare, if you want to maybe build on what Valentina was saying or complement it.
Sure, absolutely. In 1 minute, picking up on the point about making sure that we're building on thinking about the medium and the long term. We just released a couple of weeks ago at WFP this resource that we mentioned that's in the presentation called 10 Things You Wish You Ought Always Known About Shock Responses Social Protection. And if I'm allowed to say one thing, I would point out number 1, which is just doing good social protection is useful in itself. I think there's a tendency now, people have been so excited by the idea of using social protection for emergency response that people think they should be aspiring to have a system that suddenly reacts at the moment when there's an emergency. But wouldn't it be better if there was a really good social protection system all the time, so that when there was an emergency, people weren't really affected? Not every emergency has to turn into a crisis for people. And the more that we can build good social protection with good coverage, good quality, covering a wide range of needs, then the less there will be any sense of crisis when something big like this comes along. Thanks.
I think that was perfect. Thank you very much. Certainly something that will stick in my mind. So thank you, Claire. I will go to Chris now.
Thank you, Costanza. Very briefly, thank you for all the questions. I mean, they were very interesting, but I thought my co-panelists were much more productive than answering the questions, for which I'm very grateful. I think two conflicting ideas are in my mind. First of all, crises are about the worst moment in life to think about social protection. Nevertheless, we do it because we see the need. So while they are the worst context to think about social protection, they are probably a good moment to use political leverage to make politicians think about how social protection may help. And the other thing is that we should constantly think, and that's echoing what Claire just said, about social protection. Because if we have social protection, not every crisis or not every event or not every risk has to translate into crisis for people. Thank you.
Thank you. And I really liked what you said in your presentation, Chris, when you said, you know, we need to prepare for the next crisis, which goes alongside what both Valentina and Claire have said. It's not a one-off, you know, think immediate, but act long-term. Sorry, act immediate and think long-term. So it's long-term, it's making sure that you're prepared. Okay, so let's go to Stephen and then Helmut. Stephen, are you there?
Yeah, I'm just...
okay, we can't see you. Oh, we can see you now. So, there you go.
One thing, I mean, I guess, linked together, I mean, this whole question about, you know, it's coming up a lot, is there fiscal space? And we're still saying there's no fiscal, there is the fiscal space. It's really about political choice in terms of things. And it's very much about ideology as well. So, you know, just to give an example, in Sri Lanka, we just developed a proposal with UNICEF about a universal child benefit. It's clearly affordable, etc. But, you know, a lot of people say there's no fiscal space. However, just in December in Sri Lanka, there were very significant cuts to income tax for the rich in Sri Lanka, for which there was fiscal space, okay, which is an indirect social protection transfer to the rich, a tax cut. It's very much ideological, right? If you kept restored those tax cuts, we could easily afford the universal child benefit, which would benefit the majority of the population in Sri Lanka, not this small proportion. And we need to remember, it's very ideological. We have to understand, I hope in this course you've been looking at the ideology of social protection, where, you know, programs for the poor really are programs that benefit the rich because they pay much less tax. Universal benefits are programs that benefit the majority of the population. The rich don't like them so much because they pay higher taxes. So a lot of the discussion around social protection is about the rich protecting themselves from tax and not wanting to pay. But there is fiscal space. There's lots of fiscal space in many, many other areas. So we shouldn't really get fooled on this. And just lastly, I mean, the question of the registry, I mean, it is important to get all the digital information, it's digitized, but social registries which are being pushed, these databases with proxy means tests, there is zero evidence that they work and a lot of evidence that they don't work. I mean, in the COVID-19, they tried to use it in the Philippines. for the response, and it was a total mess. They couldn't even find a lot of people. So let's not get fooled. This is an aberration. We need to move away from social registries, improve all the other registration systems, move into technology, etc. But let's please forget about these silly social registries, which are just not working for anybody.
Thank you very much. On that note, I think we'll move on to Helmut, but I really do agree with you, Stephen, about political will. I've spent my whole life talking and trying to convince politicians. I'm an advocate, so I'm totally with you on that. Helmut, over to you for closing minute for you.
Many thanks. Well, there's so much to be said. I think that I liked very much some of the ideas which my colleagues, panelist colleagues, have said. Act immediately, but think in the medium long term. Well, here in Mexico, we also had, of course, a much smaller disaster, which were the earthquakes of 2017, and the ILO developed a project to help the regions which were affected. And what we learned there was that in a situation of disaster, of course, this COVID is not a localized disaster, it's a global disaster, but in a situation of disaster, the reaction needs to take into account that if you adopt, let's say, the wrong policies in the short term, you destroy more employment and social protection in the medium and long term. For example, the distribution of food baskets was very important, of course, in the humanitarian phase. But if that policy continues, if it is not replaced by a cash benefit in the affected areas, in the case of those earthquakes, if it was not substituted by cash benefits, then it would have an impact on the jobs in the region itself. So I think that the same thought can be applied to this reaction to COVID as well. So we need to think about policies that help increasing the generation of decent work. So the recovery needs to be with decent work. This is let's say, a kind of a standard message of the ILO, because this is what will help us also finance our social protection systems in the long run and establish those self-enforcing virtual recovery mechanisms, and I hope that we do not fall again into this, let's say, austerity cycle after the crisis, which will actually create a downward spiral in terms of social protection and decent work.
Thank you. That was very succinct, and I think it leads us straight onto thinking, what can we learn? It's about, as you said, with your very clear example, it is about building people's resilience, and I really like what you said about the wrong policies in the short term. So again, links to what we were saying earlier, thinking longer term, and this, I suppose, brings us to the road to recovery and to building back better, which is a UN concept which is taking hold now, and that we'll be asking about to our panelists on at our webinar on Thursday. So with this, I think we're a few minutes over our limit, but it was well worth it. So thank you all again for a fantastic webinar. My mind is certainly buzzing. I can see that people were saying it was very, very helpful. Everything that was talked about was very helpful. It did inspire people, if I can tell from the Q&A. So I hope it was a good use of 2 hours of your time. And thank you again, and see you on Thursday. And thank you, panelists, for all your thoughts, views and ideas, and your time especially.